Hi guys, so today is 27th day of June and today is HIV testing day. So I'm going to be showing you all how to use OraQuick HIV self-test. Okay, so in the spirit of HIV testing day, I urge you all to get tested today. Okay, it is important to know your status because it goes a long way in defining who you are, in determining your overall well-being. Okay, getting tested doesn't simply mean that you have this virus. Okay, so it's not something you should be scared of, but something that you should be anticipating to do. Okay, so if you haven't tested about your HIV status, I feel today is the great day. Today is the best day to go and do that. I believe that some health centers around can actually do a free testing for people because they are still in the mood of celebration. So I encourage you to go get tested today. Okay, love you. So I'm going to start by tearing this thing open. Okay, there's a kind of an instruction here on how to open it. Okay. It's open. So this is it. It's already open and it has a kind of a manual written in English, and this one is pidgin English. Okay, this is a manual on how to carry out this self-test. This is pidgin and this is English. I already know how to use this, but then let's just scan through. Okay, it is important to kind of time this test. When you're carrying out this self-test, one of the instructions is to time it, okay, for about 20 minutes. Okay, so 20 minutes, you time it, you get things ready. Okay, so let's get started, guys. Another instruction for this self-test is not to eat at least 15 minutes before you start the test, or use any mouth cleaning product 30 minutes before you start the test. Okay, so and if you're opening, you don't pour the liquid away. You dip your the cap, the flat pad inside the liquid. Okay, so guys, am I nervous? I don't know, so find out. Then after, when you're done, when you must have dipped your stuff inside the liquid, you have to make sure you read your result at exactly 20 minutes. Once it's past 20 minutes, like 40 minutes, you don't read again because I think it will give you an invalid result. Okay, this is what the OraQuick self-test stuff looks like. This one is the container that has the liquid. They actually wrote it on the body: do not drink. Do not drink. Because I'm going to open it. So there's still a line and instruction for opening. So I'm going to open it now. Okay. So I already opened this and this is the liquid. Okay, first you have to open the cap. Okay, I'm trying to be careful so it don't spill. Okay, it's open now. Okay, it's open. So I have to place it here. This is like a stand. It's like a stand. Okay, so placing it here carefully. Okay, perfect. And okay, so I have my liquid placed on the stand. So I'm going to get the strip and use it on my gum. Then I'll now dip it inside the liquid. So let's continue. Place the tube on the stand. So I'm going to use the flat pad now. So in the instruction is that you don't touch this part. Okay, you don't touch it. You have to be very careful with this part. So I'm going to use this on my gum, the upper parts and the lower parts. Okay, Okay, I'm dipping it inside the liquid now. This is inside the liquid. Okay, and the time is 9:19. So we're going to read our results at exactly in 20 minutes time. Okay, as you can see, it's coming up. Okay, it's coming up, guys. Immerse in the liquid around 9:20, let's say 9:20, and I'm going to be checking my results at exactly 9:40. Okay, still waiting. Still waiting, guys. This is just a lot. Sky, this is a lot, but I've actually gone through this before because this is not my first time using this, guys. Guys, this 20 minutes is taking forever. It's taking forever. So we're still here. We're still here. Still waiting. There's something in here. Okay, I think it's a preservative, yeah. There is a preservative inside. So I'm going to clear up my table while waiting for our time. So clearing my table. Hey guys, I'm back again. So it's 7 minutes more. Wow. I've actually gotten my result. I can see my result, but I just want to make sure that we complete the 20 minutes. So I'll be able to show you all. Okay, so let's keep waiting. The instructions said 20 minutes, so it shouldn't be less than 20 minutes and it shouldn't be more than 20 minutes. So what does this imply? It means that when you're carrying out this test, you have to be time conscious. Okay, you don't carry out this test without a timer. Don't assume that okay, let's say I started around 9 o'clock, so this is 9:20. No, you don't assume. Make sure you have your timer. So I have my timer here. I'm using this my watch as a timer, so don't assume, please. Okay, make sure you have a timer. It is going to help you to get an accurate result. Okay, so guys, it is 20 minutes already, and this is our result. I'm sorry you can't see it clearly, but this is very clear. The result is clear. It's not even faint, just that my camera or the flash may not really allow us to get it very well. I don't know if you can see it. Okay, so I'm going to be explaining something now. So while carrying out this test, okay, you have this line, you have the T line and the C line. This T line is the testing line, I'll be the test line. Then the C is a control line. So mind you, this control line, that's the C, is constant. Whenever you're carrying out any tests, the C is constant. Okay, so if maybe you are carrying a test and this T line shows even without the C coming up immediately, it means that person is positive, but you cannot always be sure to when you must have completed the testing. Okay, so when you're carrying out this kind of test and there is already a line at this T line, it shows the person is positive, because this T line is just like a control line. But then most times you can carry out this test and you have your control line there and the T line will be faint. Don't assume that it is an error. It's very possible that this person may be positive, but how to do this is just to go for a confirmatory test. Either you do the test again, or you go to any nearby health center or hospital to confirm, to carry out a confirmatory test. So but most times you can carry out this test and it will just be all red upward. It means that the test is invalid. So when you're carrying out this test, you have to be very sure that very careful that you keep to their instruction. Okay, so this means negative. So there is no line around the T and there is a line around the control line. So it means that this patient is HIV negative. Thank you guys. Love you. HIV self-test. So if maybe you can get this at any pharmacy around, so I know that with this video you're going to know how to carry out this self-test on your own without having to go to any health center or any pharmacy or any hospital to carry out this test. So this is so convenient. Okay, it is convenient a lot for some persons that have a kind of they feel so unease having to tell somebody they want to carry out an HIV testing. So I believe that this will help. It's going to solve that problem for you, so you can do this thing confidentially on your own. Okay, so the advantages of having this or knowing how to use this cannot be overemphasized. So if you can get this, fine, but if you can get the other one that uses, you have to prick yourself and drop your blood to use it, unlike this one that is just your saliva that is needed. So I think I actually love this because I don't like when I have to prick myself, but this is just so easy to use. So I actually recommend this. I highly recommend this. Thank you. Lovely fans. So before we go, I have to tell you how to discard this. You don't just leave this way. When you're done, remove this, okay, and put it inside where you're going to be trashing it. Okay, then you have to cover this back. It has a cap. Cover it back. This liquid, do not drink. I repeat, do not drink. Just have to cover it back. Okay, put it back here, and this, all of them should be trashed. So I'm going to be trashing them. Okay, so you don't reuse. I repeat, you don't reuse. When you're done, you trash, you dispose properly. Okay, you dispose properly. Thank